Acetaminophen is the most commonly used over-the-counter pain medication during pregnancy. In fact, more than half of all pregnant women take it, which is why this new report caught our eye. The Wall Street Journal is reporting that Health Secretary Robert F. Kennedy Jr. is planning to announce that using the popular pain reliever, Tylenol, while pregnant may be linked to autism. Now, the White House tonight said speculation about what's in RFK Jr.'s upcoming report on the causes of autism are premature. But regardless of whether RFK makes that announcement or not, there has been a lot of research on this exact question. A study, in fact, recently by Harvard University, just from 3 weeks ago, says that kids exposed to acetaminophen during pregnancy might be more likely to develop neurodevelopmental disorders like autism and ADHD. They cautioned it does not mean Tylenol causes autism. Joining us now is Dr. Mahsa Tehrani. She's the co-founder of the Arthritis and Rheumatology Clinical Center in Northern Virginia. If this report today, that study 3 weeks ago, it's not completely out of left field. A group of 100 scientists put out a statement 4 years ago saying using acetaminophen during pregnancy was risky, right?
Exactly, Elizabeth. Yes, the data has been very conflicting about the use of acetaminophen. However, this most recent study, as you said, 3 weeks ago, was a pool of 46 studies looking at over 100,000 patients globally. And they did find an overwhelming association between use of acetaminophen in utero exposure and these neurobehavioral diseases.
Yeah, but more than half of pregnant women in America take Tylenol. We don't have more than half the people in America with autism who are born. You know what I mean? That it does not compute, right?
Absolutely. Remember, this most recent study, most of these studies have been observational. We don't have the gold standard randomized controlled trials proving this, so there's not absolute causality, but the observation is strong enough for us to take a look, especially during a time where autism spectrum disorders are at such a high rate these days. I think that genetic variances, there are a lot of factors that go into play here, and further studies should shed light on who would be more at risk. But the bottom line at this point is we have this additional data, and I do think that we have to be a bit more cautious about how we advise our patients about taking acetaminophen. For example, my patients who have arthritis, it's been my go-to recommendation: take Tylenol for your joint pain. I may have to consider that. I also want to say, though, we should not allow pregnant women, I don't want them to be scared if somebody's pregnant and has a fever. That fever absolutely should be treated. And this is where shared decision-making comes into play. That high fevers can increase birth defects, miscarriage rates. So it's important to have a discussion with obstetricians and gynecologists about this new data.
Yeah, Tylenol is what, pregnant women turn to. I know I did when I was pregnant both times. It's what's considered safe.
Yes.
So, and many pregnant women take it. All right, Dr. Mahsa Tehrani, a lot more, I think, to be teased out here, but really appreciate you coming on.
Thank you for watching. Subscribe below and download our NewsNation app right now on your phone, and you will get fact-based, unbiased news for all Americans.